Hi everybody and welcome back. The next modality we want to talk about is magnetic resonance imaging, or in short, MRI. It is important to note that magnetic resonance imaging is such a complex technique that it cannot be explained in just a few minutes. Rather, it fills a full graduate program. Therefore, this lecture will serve as an introduction and brief overview. At first, let us take a look at the setup. This is what an MRI scanner looks like. From the outside, it is not much different from a CT scanner. You again use an examination table which moves the patient forth and back through the tube. However, MRI examinations take several minutes to hours in extreme cases. Therefore, they are not suitable for emergency medicine. So, how does this machine work? As already mentioned, the image generation process in MRIs is highly complex and goes beyond the scope of this course. But in short, images from within the body are generated by measuring magnetic properties of tissues in a strong magnetic field. The great advantage to X-ray imaging is that no ionizing radiation is used. In contrast to standard radiography, many different image contrasts can be generated in an MRI due to the physical mechanisms for image generation. Usually, image pixels or voxels that have high MR signal intensity have high intensity and vice versa. The image intensities are usually relative values and therefore unique for each patient and scan. On the left, you can see two different contrasts of brain images called T1 and T2. In T1 weighted MRIs, the ventricles located at the center of the brain are dark, whereas in T2 weighted MRIs, they are bright. When I tell you that those ventricles are filled with fluid, you can summarize that in T1 weighted MRIs, water is shown dark, whereas in T2 weighted MRIs, it is shown bright. As usual, let's conclude this short lecture by looking at some examples. On the left, you can see an MR image of an ankle in sagittal orientation. The central image visualizes an MRI of the chest in axial orientation. And last but not least, on the right, you can find an examination of the brain that revealed a metastasis. In contrast to CT images, MRI is particularly suitable for the examination of soft tissues such as muscles, nerves, the brain, or organs. In the next and final lecture of this brief introduction into medical imaging, we will talk about the positron emission tomography. Thanks and see you soon.